Good morning. Good morning. It is great to be back here. People often wonder what a lieutenant governor does. I got to hang out at places like this, and anytime we just want, my curiosity was always so piqued. I remember being asked to speak to a national gathering of people on synchrotron light sources, like, okay, what is that? So I came out here and realized that this is where it all happens. I mean, the rest of the world watches what we do right here at this incredible national lab. And it is a national lab. Not every state can lay claim to having a laboratory like this that, as you heard from our previous speakers, draws people from around the world to come here to innovate and to help find solutions to the challenges we face, particularly in healthcare. And now more than ever, we have needed the partnership, the synergy be created by Stony Brook and Brookhaven as we try to work to find solutions to getting out of this pandemic. And so I came here 6 months into the pandemic and watched the incredible work that was being done at the microscopes and seeing how the analysis of proteins to try and actually figure out what was going on here. And now to come back and see that our state investments a number of years ago in these microscopes has paid dividends, and that companies and pharmaceuticals are coming here to test and to research and find, is there another generation of vaccines and treatments that can be first thought of by brilliant people here. So that's my way of saying I'm glad to be back. And I'm glad we have Brookhaven here. And Doone Gibbs, you've been an incredible leader. We've worked closely through the REDCs as well, making sure that we make smart decisions with our economic development dollars, and you've been incredible with that as well. Also, we have here Kevin Law, who will soon be my, once he gets through the Senate. Kevin, don't screw up between now and then. As they say, keep your nose clean. And also, I look forward to having you be not just a voice for Long Island, as you were for many years as the head of LIA, where I spoke this morning, but also the way you champion the business community, but fitting the right formula there so we can support labor and support business at the same time. I want to thank Kevin Law for his willingness to be the chair of Empire State Development. And as you know, I'm very, very fond of my SUNY institutions. I am so energized at the prospects of what it's going to be when we unleash the full power of Stony Brook. And that starts with my confidence in its leadership. And President McGinnis, you have just done an incredible job of inspiring that confidence in me, but all across our nation, people know that when we do hoist up the flag and call you an official flagship part of our institution, that we do that with tremendous pride. So thank you for all you do, but also the innovative research that is occurring right here because of the partnership that we have. So I don't take that for granted. I think it's just absolutely extraordinary. Also, proud to have people like Sean McSweeney, who we've walked through and talked about this for a long time, many visits, and John Hill, our Deputy Associate Director, and also our elected officials are important. Assembly Member Giglio, I want to thank you for, first of all, being willing to run for office. It's not always easy, and I want to thank you for your contributions as well. So I wanted to just talk about what has been going on here, how exciting this is, but also to talk about where we're going with this pandemic. And the reason I want to do my update on the pandemic right here is because I believe that it's places like this where we'll find the answers, so no longer will we be paralyzed the way we were back in March of 2020 and for months and now years beyond, where we were brought to our knees because we did not even have treatments or vaccines. And Stony Brook, working with Brookhaven, have been at the forefront of the research that has helped us be where we are today. We have life-saving vaccines, but always asking the question, what's next? What's next on the horizon? Is there a way to analyze proteins in a different way and attack them so we are prepared should this happen again? We've had the warnings. We now know that we have to be proactive in being anticipatory of what could happen in the future with respect to this pandemic. So it's great to be here. I will also give an update on where we are in our numbers, and I want to thank all the research that's being done here at Brookhaven, right here on Long Island. Yes, you look closely at that, that's a model of all the proteins, right? That's about as basic as I can say it, John? Yeah. Those red things are proteins. Right. Don't ask me any more than that, okay, John? Okay, we're done with that part. That's my knowledge. Red is, I hate to, they look kind of like chicken wings. I'm from Buffalo, so everything looks like a chicken wing. I don't know. But really, yeah, I was here to launch an electron ion collider with Senator Schumer. That is going to be transformative. And again, we continue to draw people from around the world right here. And I'm very excited about what we are seeing. You've seen me here in the past, and this is one of my frequent stops. But here's a trend that you do not have to be a Brookhaven scientist to see. Look at this. The trend is heading in the right direction. The 7-day average of cases is going down. Statewide, we are at 28,296. That's a down from 90,000 since January 7th. In the same month, we were at 90,000 new cases. That's a 66.6% drop in 2 weeks. We have been waiting for this moment. We are finally trending the direction we want to go down, and that is downward, downward, downward. That's where I want to hit those numbers until we can get back to what you see back just November. It seems like an eternity ago. It's just November 26th when the World Health Organization actually gave a name to Omicron. And that is the exact day that I put forth an executive order to allow me to have emergency powers should I need to execute them, so we can amass supplies and PPE as well as the testing kits, which we now have record numbers of. So that's extraordinary. Statewide testing is still going on. Some days we're at 300,000. We're at almost 300,000 right now. Let's look at Long Island while we're here, though. We have about 3,500 cases on Long Island. We hit a peak of 14,000 on December 31st. So what a drop from 14,000 to 3,500, a 75% drop right here on Long Island. So our positivity is going down. Our peak was January 2nd, 23% positivity. And that was what we had actually predicted when we saw people not changing their behavior for Thanksgiving, despite all of our warning. They gathered over the holidays, and look at that peak the week after the Christmas holidays. So for the first time since December 20th, we are for the first time in the single digits again, and that is something we're very excited about, below 10%. Long Island's still a little bit higher, about 11%, but down from 27%. So we've dropped significantly in the last couple of weeks. But a lagging indicator is deaths, and we still had 154 people we lost their lives, and that is tragic. Still losing people right here on Long Island. So this is still to be taken very seriously. We are not letting our foot off the pedal until we can declare that we are in a place where we can manage without all the restrictions we put in place. But until then, we do believe that everything we're doing, continuing to keep socially distant, getting vaccinated and wearing the mask is making a big difference. But our hospitalizations are down. That is what has been concerning. That's what kept me up at night, was whether or not we would have the capacity to handle the high number of hospitalizations. We had 12,000, almost 13,000 cases just January 12th. And now we're down 1,100 to 1,100. So by region, you can see what's going on here. Long Island hit a very high number. That's that yellow one at the top there. And they've been trending downward as well. And again, there's a lag of about 2 weeks for upstate New York. We're continuing to monitor upstate. We do have a lot of overwhelmed hospitals there, and we need to keep addressing that and deploying people. So just looking statewide, again, Long Island, New York City looking good. Mid-Hudson, these are all the numbers where there's been a change in the last 7 days. Look at that, down 24% in 7 days here on Long Island. All the areas are trending downward except for a few. The southern tier has an increase, central New York and the North Country. So we're watching those very closely, adjusting hospitalizations. Many of them still cannot do elective surgeries because we need that capacity. So we're doing well overall statewide. And another issue that we raised a couple weeks ago was asking the question, is everybody who's in the hospital for COVID, as we're identifying as in there for COVID, did they go to the hospital because they were so sick with COVID they need to be in a hospital, or did they go there for another purpose? You know, maybe they had a heart attack or were in a car accident, something happened, and they all get tested and they happen to be tested positive for COVID without the symptoms. So the question was, how severe is this? And that's why we are the first state to identify that there should be a separate way of calculating. So right now, about 43% of COVID patients are admitted for non-COVID reasons. They're just in the hospital because of that. So that is another indicator that, yes, people are hospitalized with it. There's, as you can see, the lower number. Upstate New York, it's much higher. But here on Long Island, about 58% of the people are admitted because of COVID, and the rest are lower. So that's a trend we're watching as well. I do want to announce today that we're deploying more people to nursing homes. Why nursing homes? We saw the incredible vulnerability of our nursing homes. When the original COVID-19 hit, it just went through nursing homes like wildfire. And we have kept a close eye on our nursing homes to make sure that they had plenty of test kits. We deployed test kits, vaccinations, required that people be vaccinated who works there, booster shots. And now we're realizing that the staff are exhausted, they've been overworked, and we literally have to send in the National Guard to help in a number of our nursing homes, even in New York City, who need help. They need some relief. So we already had about 120 medically trained National Guard members in there. Now we're deploying 88 non-medical because we just need the extra set of hands in our nursing homes to give out support to our frontline staff. That's starting very shortly, and we're going to be rolling that again upstate as well. It's, again, that's just another reminder that this is not over. We still have stressed out, overworked healthcare workers who are on the front lines. They've been there since March of 2020, always waiting for that silver lining, and it just has not been coming, so we're adding some extra help. And just to amplify that, when I was trying to assess what resources I could deploy into hospitals, nursing homes, places to administer vaccines, I said, why not send in the National Guard? Send them in for everything. But I realized that many of them were not medically trained. So literally for the first time ever, we're requiring the National Guard to be trained to be able to handle medical cases, administer vaccines, and our first class is going to graduate from that training in a matter of a couple of weeks. So I'm excited about that. That is a new shift. So even if it's a flooding situation, a hurricane where you need people with medical help, our National Guard will literally be able to be there to support the EMTs and the first responders. So we're excited about that as well. I mentioned tests a couple times. We have already secured 73 million tests. This talked about by the President. We were all over this early on. Again, November 26th, started seeing what was happening in South Africa and other countries, realizing that this could get wildly out of control on short time. So we've already distributed over 16 million tests, 10 million to our schools. Why to our schools? Because I said after the winter break, when kids all go back after being in a fairly safe environment in school, but now they've been with their families and older siblings coming back from college and aunts and uncles, we could be in trouble in our schools. So we ensured that every school district, private and public, had the tests to be able to send home with students so they can literally have them for the parents to test them. If someone in a classroom tests positive, they don't all have to isolate for 10 days anymore. Go home the next day, test again, come back if you're negative, stay home if you're positive. So it's been part of our effort to keep our children in schools because we saw how devastating the effect of having them work remotely for such a long time was, and that's an issue we're addressing in our budget as well. So we're getting those out to child care centers. All the counties have been grateful. I talked to our county executive, Steve Vallone, about getting more to them as well. So we've been very much hands-on in ensuring that there were no shortages of tests available for people in the state of New York. Vaccines, we're still trying to get those numbers up, focusing on our kids. We need more children in that 5 to 11-year-old age group. You can see the numbers upward, but they kind of have stabilized. I want to see those much, much higher. So please, parents, if you've not done this, there's still plenty of time. And we're continuing to focus on our Vax to School efforts. Vax to School, let's keep the kids in school. And so now we're announcing new pop-ups, places where parents, yes, take your kids, anybody in your family. And these are sites all over that we're amplifying this in addition to all the testing and vaccination sites that we already have. So that is what we're doing. Boosters, trying to get more up there. Long Island has about a large number of people boosted, but also statewide we're at about 5.5 million. There is no reason people are not boosted. And this Omicron variant showed us that those who were vaccinated and boosted had a much lower chance of being hospitalized. Yes, a lot of people got it. We all know the stories. My sister, my son right now, they weren't with me. They live somewhere else. But they're not that sick. They're just going to be home for a few days. And otherwise, the hospitals with people with COVID are the ones filled with ones, particularly our kids. 91% of children hospitalized are children who are not vaccinated. And that's entirely preventable. So let's remind people that this is still something we have control of. We did not have this a year ago. This was not widely available. If you remember this time, we were just talking about getting them into essential workers and nursing homes, and everyone's saying, when am I finally going to get my availability of a vaccine? They are plentiful. There are no excuses, and the boosters give you that extra suit of armor around. So let's wrap up. Trending in the right direction. We're not through the surge yet, but boy, those numbers look good, and I'm really excited. Again, I want to thank everyone here. Just want to put a spotlight or a synchrotron-like source on the work that's being done right here, because you are at the forefront. The individuals, the smartest people on the planet who gather here at Brookhaven, you've made a difference. And I want everyone to know that your research and development and working with our pharmaceutical companies have been so instrumental in allowing people like myself to say, we will get through this. So I want to thank Brookhaven and Stony Brook and all of our partners in the medical research field for what we're doing and what you continue to do. So thank you, everyone, and I appreciate you joining us today for our update. Any questions? And if it's all about how these microscopes work and telescopes work, please do not ask me.
The question is a little simpler than that. Governor, the Massapequa Board of Education in Nassau County here, for Bruce Blakeman as the county executive, last night they passed a motion giving staff and students the option of whether to wear a mask or not in school, starting on February 21st. This is a direct contradiction of your statewide order. What is your reaction, and what do you plan to do about this? And secondly, we also have on Long Island here Connecticut High School, where the teachers union says that the situation is, quote, out of control, with most students walking the halls with the mask under the nose or the chin or no mask at all. Again, what do you plan to do about this direct challenge to your authority? So far, you have not really taken any actions on these challenges, though previously this month you asserted you are not a pushover.
Okay, so first of all, I'm not a pushover, and I've not taken an action because these actions occurred yesterday. So you got to give me a little more time. I think it's been less than 24 hours since they made a statement related to this. So that's the reality that I'm dealing with. But also, personally, as a parent, I find it phenomenally disappointing that people are willing to play politics with children's lives. And you heard what I said. Schools were the safer place for children, not when they went home. They got sick when they went home during the holidays. Schools are safe, and why are they safe? Because people have been wearing masks, kids have been wearing masks, and they're adapting to it. It's not something we're going to keep much longer. We know we don't have to. But this has kept children safe and in a learning environment. And I fully expect school boards and other leaders to recognize how important this has been and why our children are safer. We're seeing fewer hospitalized, fewer sicker, because they've been able to be in an environment like a school where they have been enforcing this. Now, my understanding is what the first school district said was that they're going to, when the state mandate lapses, according to the resolution, that they won't follow it. When you think about that, break that down, that's actually what we expect. When the state mandate lapses, I expect all school districts will say we don't have to do this anymore. So I'm not sure what they were trying to say on that front, but newsflash, when the state requirements lapse, everybody cannot follow them any longer. So there we go. And with
is there a February 21st expiration date on the
No, there could be before then. We don't know. I mean, I'm going to continue to use the element of time and at the right time assess where we are. When we put this in place, we fully expected that we would have no longer a need for a mask mandate in schools until November 26th when Omicron hit, because we are trending down in a beautiful way with Delta, and I foresaw on the horizon that we'd be almost done with this, and then unforeseen circumstances. So I'd be negligent if I said now on a certain date something's going to happen, and I think people respect that. Those who are not just playing politics and trying to get headlines will understand that, and I'm going to reserve that right. Could it be? Yes. May it not be? Yes. I don't know right now, and I don't expect to know. But I'm watching the numbers. The trend is great. The trend is great. And if people get their kids vaccinated, I won't worry so much about their kids either. Vaccinated and boosted everybody over the age of 5. And in terms of what's going on in other schools, yes, we'll look into that. You know, we've already having conversations with the state education department on making sure that these are followed because they're common sense. It's the right thing to do. It is not permanent. One of the best days I look forward to, other than being done with our budget this year, is the day I can say these requirements are suspended and they did the job they were expected to do. We kept New Yorkers safe. Thank you.
Hi, Kristen Thorne with Eyewitness News. Thank you. Given all the positive trend that we're seeing, do you think the February 1st indoor mask mandate, the vaccine requirement, what is your view on that now? And also test to stay. Have you thought about looking at 2 to 5-year-olds, that preschool, that nursery age? They at this point cannot, they don't have any of this option. Have you thought about them in this picture?
Yeah, and I'll tell you about February 1st on January 31st. I really do need to wait until that time. Trend is looking good, and I'm an optimist, but I saw a very good trend just early in November, and then everything changed. So we will let people know about that indoor, the mask or vaccination requirement, which has been, and I want to thank everybody who followed that. I mean, all the business owners and who've kept their employees safe, their patrons safe, their customers safe. I'm really proud of what New Yorkers have done primarily. I am concerned about the children as well. That's why we have deployed tens of thousands of test kits to the nursing homes, because that's a point of vulnerability. And these kids are particularly vulnerable because they can't get vaccinated. And those, we're seeing an increase, not a startling one, but an increase in children that age getting infected by older siblings who bring it home from school and from other classmates and from other places. So that's a vulnerable population. But assessing the test to say, I think we can look at that. You know, we can definitely look at that and see whether or not we don't have to shut down the nursing, the child care. So you have someone that was, okay, yeah, okay. You first,
My child's class has been shut down once already for 10 days. You still have to pay the nursery school, and you have to pay someone else to watch your child. And now we almost had another scare that it was going to be another 10 days. So this 2 to 5, they have no option at all for test to stay.
And what I would say is we're analyzing this, and I will look at this, is that those children are not as safe as children who've been vaccinated 5 years old and up. That to me is the difference. Now, I am not satisfied with the number of children in that age group who are vaccinated. They've had months to do this. And for parents who were nervous about it, who wanted to wait until they saw a lot of other people go first, tens of thousands across the country, hundreds of thousands of children 5 years old and up have been vaccinated successfully. And I want parents to know that this is what you can do to protect that child. And if you have younger siblings, if you have a 5 or up to older, 5-year-old and up, they've got little ones at home, they got to do that to protect them, because until the CDC says it's okay, we can't get vaccinations for those children. That's the reason why we've treated them as different categories, but I understand how hard it is on parents. I've had child care workers are the essential workers for the essential workers. Statement of fact. No. One more? Okay.
Regarding the mask mandates, I want to know if the state has a particular number, whether that be like a test positivity rate or a hospitalization rate, that when we go under that, the mask mandates will be lifted, or is the state playing that by ear?
We're not playing it by ear. We're going to be driven by data and look at what our situation was prior to the mandates and assess, was that the right number to go back to? I can't say with certainty, but that is a starting point to look at the number before we instituted these. We instituted these because we saw the storm coming our way. We watched the global trends. We saw how quickly this escalated upward in other countries like England and South Africa, and we knew that could hit us. That's why we took steps literally the day the first case arrived in New York State, which was December 2nd, and announced the first series of restrictions on going up for the next couple of weeks. So I think about this a lot. I'm not going to operate in a vacuum. We're going to have data and experts and people who know a lot about what the next trends are. But I am really looking forward to lifting them. I truly am. I know people are tired, but I'll say one thing about the kids. my daughter had a meltdown over having to put sneakers on to go to kindergarten. She got used to wearing sneakers in school. I mean, they adapt better than adults do. And I'm really proud of the parents who made sure that their kids understood this is for their safety and got it done. But we're looking forward to the day we can lift the school as well as the business requirements. We truly am. That'll be a very fabulous day. That means that we've turned the corner in a way that we don't feel like we're going to be sliding backwards anytime soon. All right. Thank you very much, everybody.